There has been a quite interesting evolution of the drug situation in the European Union over the last 5 to 8 years, I would say. What we observe today is an overall increase in the global production of any kind of drugs, which results in terms of impact on the European drug market in a high availability of any kinds of substances, but also a high level of purity and potency. And this is reflected, for instance, by the increase in the number of seizures that are made through large shipments that have been intercepted either in big ports in Europe or en route to Europe. To give you an example, we don't have yet the final figures for last year, but in 2018, there were 181 tons of cocaine seized in the European Union, and it was more in 2020. Just to give you an idea, a comparison, 30 years ago, when there was the start of the crack epidemic, it was 100 tons of cocaine. Today, only through the large shipments, it was 181 tons in 2018 for cocaine. But there were 668 tons of cannabis that have been seized. And heroin, around 10 tons of heroin seized. And for the first time, through big shipments, mean containers too. So situation, the picture is threatening. There is a potential risk for the EU. And we also count that more or less 96 million of adults in the EU aged 15, 64 years old have tried an illicit drug in their lifetime. And we have 1.2 million of people, more or less, who are in treatment for a problem related to heavy or problematic drug use. So that's in a nutshell.
Alexis, these are very disturbing statistics indeed, but you talk about the number of seizures. What does that say to you about how much is getting through?
That's the £5 or $5 or €5 question. And I will disappoint you, I don't have the magic formula to give you the answer. But what we know is that through a convergence of different indicators, you rightly mentioned, I spoke only about seizures, but we connect, we analyze those data with other, and we cross them with other indicators, which show that there is an increase in the consumption of cocaine use in the EU. There is also, which is also quite worrying, some pockets of crack cocaine use that are appearing in Europe, which was not the case 5 years ago. Even though for crack users, the situation is a bit difficult to measure because as they are not really in treatment. What we have also observed is an increase in the number of demands for treatment of addiction issues related to cannabis, which can be related, partly at least, to the much higher concentration in THC that is found in cannabis. If you want a comparison, at the time of Woodstock Festival or May 68 events in Europe, the concentration in THC of that cannabis was probably between 4 and 6%. But today it can go up to 24%. And in some of the products that are produced in some states in the US that have legalized the recreational use of cannabis, you can find even e-liquids for vaping that contain up to 95% of THC.
How would you describe the impact on societies and economies in Europe of addiction?
Well, first thing to say is that the EU is the unique region in the world for more than 20 years that has designed collective strategies joining the efforts of the 28 and now 27 European member states together with the European Commission and European agencies like us, the European Drugs Agency and Europol, to develop strategies and develop joint efforts. And it gives results, it shows results. For instance, if you look at the dramatic decrease of the numbers of HIV and AIDS drug-related cases over the last 20, 25 years, that's one of the excellent results of those joint efforts. If you see the increase in the availability of opioid substitution treatment that passed from 35, 40,000 places in treatment in the early 90s to a total of around 650,000 people who are in treatment for opioid substitution treatment. It shows that the member states have made joint efforts, and they have also developed and established a good response capacity, which is not the case in other regions in the world. Certainly, there is a concern and a close monitoring based on the work that we are doing, among others. And the member states coordinate their actions, and for that purpose, there is a special...
That is very good news that you have this policy and strategy. But is that strategy winning against addiction in Europe?
I think winning is not the exact term that we are seeking. I think if you want to eradicate, or if someone pretends to eradicate completely the drug problem, I think this is not the way we are looking at the things today if we want to be realistic. It's also important to be clear about having political objectives or policy objectives that are feasible. And the EU strategy on drugs that was recently adopted in December by all EU member states shows and is based on the results and the evaluation of the previous one. So yes, in Europe, in the European Union, we evaluate and we monitor the objectives, and we record significant results. Now the situation is changing and is bringing new challenges. This is why we needed to regularly update the strategy. Now we are working on a new action plan for the next 5 years period.
Do you only lead a European initiative, or do you try and bring in other partners from around the world?
Well, first of all, we have, of course, our mandate covers the EU, but we are working very closely with the countries from Southeastern Europe, with also all the countries that are neighboring the EU, but more broadly with other regions of the world and with other international organizations. On the top of that, the EU has established a dialogue on drugs with some countries, and the last 22nd of January, for the first time, took place the EUChina dialogue on drugs.
And what did that involve, the EU-China dialogue?
But the topics that were discussed were starting first on the sharing information of the last trend on the drug situation, both in the European Union and in China. And on that specific point, I was asked to make a presentation on the EU situation. What was very interesting was to see that we shared the same challenges with China. In particular, the colleagues from China explained that they have a real concern with the increase and the rise of synthetic drugs and new psychoactive substances, as it is the case also for the European Union.
So China and the EU coming together in the war on drugs?
Yeah, they come together and at least establish a very high-level dialogue on those issues, acknowledging that there are differences in the policies and the strategies, but also there are common endeavors. And it was agreed that the dialogue will deepen, will continue, and the next annual meeting will take place, hopefully, in physical presence of all the participants next year in Brussels.
Alexis Goosdeel, many thanks to you for joining us on The Agenda.
Thank you very much. My pleasure.